Many people may not be aware, but tinnitus is not a disease, it's actually a symptom. It's a sign that there is something going wrong with the auditory system. In short, this includes the ear, the auditory nerve that connects to the inner ear to the brain, and this part of the brain that processes sound. At this particular juncture, there is no cure for tinnitus, but there are ways to make the condition be more tolerable. And if you're not sure you have tinnitus, there's also a possibility that you may have something less severe. See, the problem with Eustachian tube dysfunction and tinnitus is they're almost like cousins. I dealt with this issue for many years, and I had bouts of tinnitus, but it didn't stick around and it wasn't full force. My condition was more of a Eustachian tube dysfunction issue caused by many symptoms, and one of those symptoms happened to be tinnitus. For many people who have developed a chronic condition of tinnitus have developed symptoms of hearing loss. When you lose hearing, your brain undergoes changes in the way it processes sound and frequencies. And what should be publicized more and emphasized more by medical professionals is tinnitus is associated with high levels of emotional stress. This causes depression, anxiety, and insomnia are not uncommon in people with tinnitus. I should also make note that tinnitus can sometimes be a symptom of a problem with TMJ. If your tinnitus is caused by a severe bout of TMJ, then a dental procedure or realignment of your bite may alleviate this problem. And in my case, when I had bouts of tinnitus, I was extremely fortunate that it wasn't a severe case of tinnitus and I was able to alleviate those symptoms. As what was mentioned before, again, tinnitus is a symptom, not a disease. So if you find yourself dealing with the constant ringing of the ears, you're dealing with depression, anxiety, it's not the end all for you. You can actually recover from having small cases of tinnitus. The purpose of my video and my message is to allow you to realize that this is not the end. You could be dealing with a Eustachian tube dysfunction problem that could be causing tinnitus-like symptoms. This was my case. I did not have a full-fledged force of tinnitus, so I was able to resolve what I was dealing with and able to move on. Just to recap on a few things that I did to recover from having these issues is that I did do red light therapy. This was a very essential practice, and it was something that I wanted to try, and it actually helped get rid of the problems I was dealing with. As well as I stayed in touch with my dentist. I kept my teeth clean, got rid of all the cavities, made sure my bite was right, and you want to make sure that you do the same. And last but not least, my diet had to be adjusted. I had to cut out a lot of fatty foods, get rid of all the harmful sugary drinks, and start increasing vegetables. Getting rid of all intake of coffee, even decaf, and making sure to minimize my dairy intake. With all of this combined, I was able to recover from having Eustachian tube dysfunction. So if you're dealing with tinnitus and you're not sure how it came about, you may be dealing with a very, very minimal case of it, that it's a possibility you can get rid of it very quickly. And by very quickly, you can start the process. Don't expect 24-hour results. Start doing simple things to really maximize results. I guarantee if you start with the basics, better diet, get rid of some of the caffeine, minimize the fatty sugars and drinks and things that don't help your body. Just believe that you have the chance to heal and trust your body. Make those adjustments and I guarantee you'll find better results than you ever have. Just keep being persistent and confident in the process, and I can see you healing very soon. Take care, everybody. Welcome everybody, Jaye Wellness here with you again. Today's topic is on the Valsalva maneuver. Many of you have heard of this maneuver and have probably asked the question. Those of you familiar with Eustachian tube dysfunction have run across the maneuver called the Valsalva maneuver. So we're going to cover why is it important and if it's dangerous or not, and does it really help with Eustachian tube dysfunction. Stay tuned. Valsalva maneuver has been used for quite some time. Most predominantly, it's been used to treat clogged ears and also restore heart rhythm. It's been speculated to help relieve pressure that's blocking a eustachian tube from functioning normal, also relieving pressure in the inner ear. When performing the maneuver, clogged ears can be unblocked by forcing air through the sinuses and the eustachian tube. More so than recently, practitioners have gone against the idea of individuals inexperienced who are dealing with Eustachian tube dysfunction performing the Valsalva maneuver. It's been noted in the past that when performing the Valsalva maneuver without caution, it has also been known to rupture an eardrum. So when doing so, it's going to take a very gentle approach. To perform the Valsalva maneuver, you pinch your nose close your mouth, and forcefully exhale. Now, you want to bear down, similar to having a bowel movement. Hold this for about 10 to 15 seconds. Once doing so, you'll realize that air will slowly start escaping from your ears. Now, the reason why practitioners are a little cautious about having this done is that when doing so, you can really cause damage if you're forcing it too hard. I will tell you that maybe 6 out of 10 physicians will tell you to refrain from doing the Valsalva maneuver, but some of the older practicing ENT providers will probably tell you it's useful, and if you do it correctly, it's very beneficial. Now, to my own personal experience and my own opinion, I used red light therapy frequently to really break down the inflammation and fluid buildup in my ears. Red light therapy is nothing new to the world, but using it for the purpose of treating Eustachian tube dysfunction has not been publicly known. I can tell you firsthand, when using red light therapy consistently, about 8 days approximately, it healed my Eustachian tube almost immediately. By almost, it was a slow, gradual process. Each day, it would slowly be less whooshing in my ear, less popping sounds in my ear. Having to really maneuver myself around was starting to get much easier throughout those 8 days. Most people using red light therapy will almost expect immediate results. I can guarantee you that this may not be the case for you. You have to be consistent, and like anything else, you can't just take pain meds and continue the destructive behavior. You have to make changes in your diet to find out what is causing this problem. The red light therapy is going to need assistance to really do its job. You cannot simply alone use red light therapy and expect extravagant results. But what I can tell you is when you use red light therapy, you're going in the direction of healing, and that's something that many people were not doing before. Now, back to the topic at hand, the Valsalva maneuver. Did I use this maneuver? Yes, I did. Using red light therapy, I also executed doing the Valsalva maneuver. This made my Eustachian tube work itself out and eventually landing in a position where it should have been in the first place. What ended up happening is one of my Eustachian tubes got out of whack and caused a lot of pressure and fluid to build up, giving these symptoms that you all know about. To my own personal experience and opinion, I will tell you that the Valsalva maneuver really helped me relieve pressure in my ear while doing the red light therapy as well. If your issue is similar to what I was facing, having this buildup in one ear, this pressure, the tinnitus, doing red light therapy consistently along with doing the Valsalva maneuver very carefully, you will see tremendous results. So just to conclude, the Valsalva maneuver is not a hated maneuver. It's a maneuver that should be practiced with caution. If you do it really gently and very cautiously, you will also get results doing the Valsalva maneuver. So stay consistent, everyone, and remember, everything takes time. You have to give your body time to heal, because where it is now in the position where you are dealing with this terrible condition didn't take 2 to 3 days to get to that point. You can't expect it to take 2 to 3 days to heal. So give red light therapy a chance. It can be a really tremendous and miraculous recovery if you just give it a little bit of time and let your body heal the way it's meant to heal.
Still wondering why tinnitus won't quite go away? Stay tuned because myself and the Jaye Wellness team will go over some simple but effective causes that can prolong this horrible condition. For some cases of tinnitus, the cause is merely the result of an accumulation of wax in the ears. Earwax, medically referred to as cerumen, is a substance that is produced by glands that lie within the ear. It serves an important purpose, as it protects the interior of the ear by catching any debris that floats in. Under normal circumstances, earwax is supposed to naturally push its way out of the ears, occasionally wiping down the outer portion of the ear with a damp cloth to remove the wax that has been pushed out is all that is really needed. However, some people use cotton swabs to get inside the ear to remove the accumulation of wax. This can cause the earwax to become impacted, or pushed back into the inner ear. An impaction of earwax can result in a terrible ringing sound. Ear infections are often thought to be a problem that only affects children, but adults can develop ear infections too. Infections of the middle ear, known as otitis media, can develop when bacterium becomes lodged within the auditory tube. The auditory tube connects the middle ear to the back portion of the throat. Typically, middle ear infections occur when a clog or obstruction blocks the auditory tube. Usually this clog or obstruction is caused by mucus. Infections of the middle ear are often associated with ringing or buzzing sounds. In addition to tinnitus, symptoms that are often associated with otitis media include fever and pain in the affected ear and some degree of hearing loss and even vertigo. If you are experiencing tinnitus and several of the other aforementioned symptoms, it's likely you are suffering from an ear infection. Once it is treated, the symptoms typically resolve. In some cases, ringing in the ears is the result of changes in blood flow. For example, anemia and high blood pressure are two conditions that are known to cause tinnitus. When blood flow causes ringing in the ears, the type of ringing or buzzing that occurs in the ears is referred to as pulsatile tinnitus, which sounds similar to a heartbeat, or whooshing in the ears that is followed by a rhythmic beat. Pulsatile tinnitus is rare, and though it's similar to other types of tinnitus in that a phantom sound is always present, it differs in that the noise is generated from within the body. The pulsating, whooshing sound may also be heard by others. For example, a doctor who is using a stethoscope might hear it. Because of the rhythmic, heartbeat-like sound it creates, it's also referred to as vascular or rhythmic tinnitus. In some cases, tinnitus may be caused by temporomandibular joint disorder. There are two temporomandibular joints or TMJ, located on either side of the jaw. The joint connects the jawbone to the skull, and disorders of this joint can result in the aforementioned condition known as TMD, though many people refer to it simply as TMJ. This joint serves as a hinge, allowing you to open and close your lower jaw. The bones that connect with the TMJ are coated with cartilage, which protects the joint, and are separated by a disc that absorbs shock. Disorders of the TMJ can occur for a number of reasons: erosion or misalignment of the shock-absorbing disc, arthritis, or bruxism, which is excessive tooth grinding. Whatever the cause, TMD can result in tinnitus. Otosclerosis is a condition that is marked by the unusual growth of bone that occurs around the stapes, one of the small bones that lie within the middle ear. As this bone hardens, it cannot freely move, which minimizes the proper transmission of sound. The result of this bone growth stops structures that are located within the inner ear from functioning correctly and prevents sound from being properly transmitted to the ear, which results in hearing loss. The less the bone can move, the more severe the hearing loss will be. The loss of hearing that is attributed with otosclerosis can lead to buzzing or roaring sound that's associated with tinnitus, as the brain picks up absent signals that are sent from the ear and turns them into humming or buzzing sounds. Other symptoms of otosclerosis can include difficulty hearing quiet or low sounds and increased hearing loss. It's estimated that more than 1 in 10 cases of chronic tinnitus are related to injuries of the head or neck. Unfortunately, the tinnitus that is associated with head and neck injuries tends to be more severe, and the symptoms are worse than other types and causes of tinnitus. Head and neck injuries can cause issues with the blood flow, the nerves, and the muscles of the ear, which can lead to the development of the perception of sound. Whiplash or a blunt blow to the head can result in tinnitus, for example. These injuries can impact the structures of the inner ear, the nerves that are responsible for transmitting sound to the brain, or the way in which the brain deciphers sound. Typically, tinnitus that is caused by head and neck injuries only affects one ear. However, the effects are usually severe.